Well, it's nice that for patients, it's nice for patients to see what we actually do. That the diagnosis and the treatment, it really is an ongoing collaborative effort, and that we really do talk to each other, and that these brain tumors are extremely complicated, and it's just a good thing for them to see how these diagnoses and treatment, how we arrive at these things.
So how do you utilize the ABTA? Why are they a resource for you?
Well, they helped support me in my fellowship work at the University of Pittsburgh, and that was a big step forward because now I'm NIH funded as a junior investigator at the University of Kentucky. So the ABTA has been is very, very critical, and some of the work that I actually presented here was funded by the ABTA.
And how are they a resource for your patients? Like, how do you use them as a resource?
Well, it's a very good resource because if they have questions on their diagnoses, and these things are very difficult, and sometimes, especially if you're telling somebody to their face what's going on, they need time to digest it. The ABTA has excellent resources that allows them to, it distills the important parts of the diagnoses and what their prognosis, and puts them in, and then they can get plugged into different treatment protocols, clinical trials. It's a very, very good liaison between clinicians and the patient.
Okay, and how about for you as a doctor and a researcher, what do you walk away with from events like this? I mean, what do you take? I know the patients get a lot, but like for you personally.
It's nice to see faces to the diagnoses. As a neuropathologist, usually all I see is the tissue. Very rarely do I see the patient, and I like to have that human contact as much as possible. It just reminds me of the importance of the work to get the diagnosis right, the first time, every time.
Terrific.